This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
Okay, so our patient has a lower extremity DVT. Which side is it if you were betting?
Left.
Good answer. Left.
Because of where it crosses.
Right. So something we don't probably think about enough in the ER is something called iliac vein compression syndrome or May-Thurner Syndrome. So if you look at lower extremity DVTs, the left lower extremity is affected 56% of the time. And think about all the DVTs that we see. That's a pretty big difference from one side to the other. Why is that? It's because a number that I think most people estimated anywhere from 22 to 24% of the population, so a large number of us, like anywhere from a quarter to a fifth of us, have what's called the May-Thurner anatomic variant, and that's where basically the right iliac artery compresses the left iliac vein against the lumbar spine. So I'll make a little that reaches. Especially if you see a patient with a recurrent DVT on the left side, you need to think about that. When you look at the diagnosis of May-Thurner syndrome in the emergency room, it's about 2 to 3% of the patients with all DVTs, so it's definitely underdiagnosed. Is an ultrasound going to get you the answer for it? The answer is no. It's too high. So it's usually too high to see. So if you're suspicious, you need to get a MRI, MRA, or a CTA, CTV to be able to see it. And usually it's pretty easily diagnosed. One of the reasons why it's important is because anticoagulation is probably not adequate. Number one, people might get a short course of anticoagulation, 3 to 6 months, and they get a recurrent DVT. But number two, a lot of times just anticoagulation in general will not take care of it. Typically you need clot lysis and endovascular stenting to take care of it. So just something to think, especially for a patient we see with recurrent left lower extremity DVT.
Hello, EMM listeners. We are dedicated to providing you with high-quality educational content free of charge and without ads. As a nonprofit organization, we rely solely on donations. So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.